Eating disorders have long been considered a female problem, but a 2007 Harvard study has indicated that it's much more commonplace with men than had previously been thought. What we have found is that men are about 1/3 as likely to have anorexia and bulimia, and about half as likely to have binge eating disorder. It is not clear why males with eating disorders have been less recognized, but perhaps there's 3 variables that we could talk about today. One might be is that there is more acceptance of larger males in society than there has been for females. There has also been more acceptance with men eating larger meals than women. And there's also less pressure for males to have the perfect body type, although this is changing. What we now know about males with eating disorders is that athletes who have a certain goal to meet a certain weight have pressure to restrict their eating and to go towards more dieting behavior, and they tend to have a higher incidence of eating disorders. Often the male route to eating disorders is through compulsive exercise, and that's something that we need to watch as well. Like women, men with eating disorders are often overachievers, they're often perfectionistic. They also can have tendencies to have anxiety disorder, obsessive compulsive disorder, depression, and substance abuse addictions. What we've found as well is that males have told us that they felt stigmatized to come forward with their eating disorder behaviors. They felt that it was traditionally a female diagnosis and felt uncomfortable in disclosing those behaviors. We also know that straight men are as likely as gay men to have eating disorders. So let's just spend a couple minutes talking about the nutritional treatment goals. Well, we need to talk about metabolism and physiology and dispel fact from fallacy. What is true about nutrition, what is true about carbohydrates, protein, and fats, and break away from all the misinformation that's in society. We also need to provide our clients with healthy weight management tools, whether they're men or women, but to look at metabolic needs in a realistic fashion. We also need to look at increasing the variety of foods and decreasing fear foods. Fear foods would be any type of food that you would consider to be inappropriate for you to have, or you would feel shamed or feel guilty to have consumed, and we need to break that down. We also need to assist male and female clients with normalizing food consumption patterns. That could be having regular breakfast, lunch, dinner, regular snacks, having fairly regular meal times as best as you possibly can. We also need to look at helping our clients, male and female, recognize the symptoms of hunger and the symptoms of fullness, which is often quite a challenge. We also need to look at differentiating physical hunger from emotional eating and help our clients just identify which behavior is happening if they are eating for emotional reasons, to redirect that emotional feeling into a healthy behavior and to give them new coping skills. Exercise should be for health and fitness, not as a way to burn calories. It shouldn't be a way to punish yourself or make yourself feel guilty, but rather for health and fitness goals. We also need to assist men in feeling comfortable in social eating situations and being able to eat at restaurants and eat with family and friends without feelings of discomfort or guilt. So in other words, we need to help the individual with a realistic discharge food plan, display good realistic treatment goals. We need to assist them with long-term health, weight management goals, and eating occasionally for enjoyment. So in summary, males with eating disorders are more prevalent than we previously had thought. Therefore, mental health professionals need to have screening tools in order to identify their male clients that do have eating disorders and to discuss treatment options that might be available in the community. The good news is that early treatment is very, very effective in turning the course around. We can help minimize the medical complications from eating disorders, as well as decrease the problems that they will have at work or at school or with relationships, and just give the client better coping skills, tools, nutrition education in order to have a healthy relationship with food again.